today we have with us Dr. Deepasri Chowdhury, who is doing her fellowship in Onco Anesthesia from Tata Medical Center, Kolkata. Welcome, Dr. Deepasri, for our National Dynamic Medical Student Summit.
Thank you.
Great. So, wonderful to have you today here. Right. So, Dr. Deepasri, so the entire intention of the summit is to give a practical view of anesthesia in this case, so that the students get a practical understanding of what goes behind the scenes and how a lifestyle of a specialist could be if they take anesthesia as a specialty. So that's the entire intention of the today's event. And so with that, let's know first what we would like to know is why did you choose anesthesia as a specialty? Was it your first choice? And how did you make a choice of taking anesthesia?
It was a very personal choice for me to take anesthesia.
Mm-hmm.
I always felt that I was better at the diagnosis part of it rather than the surgical aspects of things. So that's why I always wanted something related to medicine. Plus, I
Okay.
was always looking forward to a very dynamic life. I wasn't someone who could sit in an OPD and do my work from an OPD or do just, ward work. I needed to move about. I needed a lot of, a lot of dynamic in my day-to-day life. That's why I thought that anesthesia would be a good choice.
Got it. Right. So that and because we don't have much exposure in our UG days about anesthesia. Actually, when did you
That's the
make
problem.
this decision, and how did you make the decision of taking anesthesia?
I chose it as a second option actually, anesthesia. I
Mm-hmm.
wanted MD medicine or I wanted to pursue something in emergency medicine.
Mm-hmm.
So when anesthesia came up as an option, I chose that indefinitely.
Got it. Got it. So it was between emergency and medicine. It had some
Yeah,
combination of that.
medicine,
And
emergency medicine, something in that line. That's what I wanted to do. So that's why.
great, got that. So now, being all these years being an anesthesiologist, and also now doing your fellowship in a little more advanced domains, what do you see the pros of being an anesthesiologist?
The pros of it.
Hmm.
So as I was telling you, like it demands a lot of medical attention, medical like what is the word? Mm, you need to cut it.
Okay.
So the day-to-day works of an anesthesiologist requires us to be very alert. So
Mhm,
each and every minute, whether we're in the OT, whether in the ICUs, whether we are doing cases in the periphery, every
mhm,
minute counts for us. Things can go wrong in so
mhm.
many different ways in such a
Okay.
short period of time. So that is one thing. And plus, after this COVID pandemic, everything shifted. The dynamics of it is shifted.
Okay.
Initially, there weren't too many people who were aware of what an anesthesiologist does or the role of an anesthesiologist in the entire medical fraternity. But
Mhm.
now they have realized, what an important role we play in the ICU setups and looking after these critical patients. So yeah, that was an advantage, I suppose.
Yeah. So basically, of course, there has been advantage. I think the COVID, which was very critical at this point of time, the anesthesia played a very important role, and I think most of the anesthesiologists were the front runners who were at very proximity in contact with the critical cases. Really, that's an inspiring thing. What I think all the anesthesiologists have contributed in terms of the COVID care. Great. So now also seeing the pros, what are the cons of taking anesthesia as a specialty?
It's a very demanding job.
Mm-hmm.
Like the pros can be taken as cons as well. Like we
Yeah.
don't get too much time, free time during the work day, to pursue maybe to study something. It's always so dynamic. Everything is moving about so quickly. And the
Mm-hmm.
second thing, after taking anesthesia, I realized that if you want to at some point of time have a private practice, because anesthesia is most of the time dependent on other special branches. So unless you further divert into pain or pain management, it is difficult to have a private practice in that setup. So that's the thing. You can have maybe your pain clinic, or you can eventually open up maybe an ICU setup, but private practice doesn't really exist in like your, yeah, in anesthesia. Having your own OPD is very difficult like that.
Got it. So basically, you're telling one of the cons is having your own private practice is a
Yeah, you
difficult
cannot have
point
a
unless you
OPD
get
with
into
private.
the, yeah, unless you get into
Yeah,
a very
private practice
specialized
is what.
pain. Yeah, yeah. As anesthesia is more of a dependent specialty on
Yes.
the OTs and all those things. Got it.
Yes.
So now looking into the pros and the cons. So what are the super specialization options in anesthesiologist after MDMS anesthesiology you could get?
Mostly all the critical, I mean, all the clinical branches now at some point of time will require an anesthesiologist. I'm
Mhm,
not talking about the surgical branches. Amongst the surgical branches, we have neuro, cardiac, pediatric, onco. Then we can go into even pathologists sometimes that require us. Radiologists are going to require us.
mhm,
Dermatologists are going to require us. There is endless scope in this branch. Plus, then there comes the ICU setup that we are handling. We are then
mhm.
handling even the pain clinics, chronic pain management. So it's a totally different dimension when it comes into anesthesiology. It's like that.
Got it. So and you are also pursuing your fellowship in Onco-Anesthesia,
In
right? So
onco-anesthesia.
yeah. So why did you decide to get into and what's the scope and could you just tell something more about Onco-Anesthesia because you're already doing it? Yeah.
So presently, I think presently the most important and the most leading cause of death or chronically ill patients, that the suffering that they go through that we see in our medical practice is probably most in the cancer related patients,
Hmm.
not only for the patient itself but also for the family members. It's a huge
Yeah.
burden on them and a huge burden on society. So I
Exactly.
thought that's probably where I want to work right now. That's exactly what the time is calling for. More of us need to get into oncology and inform, get the public aware of it and help out in that sector. So that's why I thought onco would be good. Yeah, and
Yeah.
it's been
So
good.
yeah. So I think it's a really noble thought. You had a thought process in that direction and you've chosen your special fellowship there. Great, we got that. So now looking into all these areas, um, what are the job opportunities after anesthesia as in a specialty in India?
So in India, there are like three sectors that you can get into. One is obviously the medical college. You can
Hmm.
get into a teaching line, that is medical colleges, and then you can get into private practice, that is the private hospitals that have the doctors. And
Hmm.
third is your freelancing.
Hmm.
So a lot of people, they have a lot of surgeons, they have their own setups, nursing homes, and they require to have anesthetists over there. That is the freelancing part. The private
Hmm.
hospitals that require doctors, anesthesiologists, that is the private sector, and the third is the medical college. So all
Hmm.
three of them have a lot of scope.
Yeah. So there are different sectors, private, medical, corporate sectors where you can get into, right? Got it. And now if you're looking into the abroad scenario, what are the opportunities if you want to go abroad after India anesthesia? MS.
MD anesthesia abroad, as in the sense there are a lot of fellowships that they are doing, whether it is US, UK, Canada, Australia, a lot of fellowships. Plus, they are always on the lookout for anesthesiologists, especially in
Mhm.
the ICU sector. There are a lot of openings. You will
Okay.
have to give a lot of exams following that, and that is the same. That is a given in our medical field. Our lives are based on the exams that keep coming up and the advancements that keep going up. Without that, it's of actually no use to just stay stagnant. But the
Mhm.
scope to go abroad is also huge. Yes, there is a lot
Got it.
of good opportunity abroad. Yes.
Abroad too. So most of in critical care and ICU areas where I think anesthesiologists are much required in abroad. Got it. Right. And of course, there are again pre-exams, the eligibility exams to get into those countries too. Right.
Yes.
Now, coming to the earning potential. What is the earning potential for an anesthesiologist, and what is the range someone who could look forward to?
So that totally depends on whether you go into freelancing, whether you go into the private sector, whether you go into the medical hospital, like medical colleging
Hmm.
line.
Hmm.
The obviously you're going to earn maximum with freelancing, as I have seen. Max means as my friends are doing, they earn really well with freelancing.
Hmm.
But then again, there are a lot of risks involved in that. So it's like your risk versus benefit. What do you want? Do you want to earn well, or do you want to have a good, stable life with a good time span? Because in freelancing, you're going to get a call at any time of the night,
Hmm.
whether you're around or whether you're asleep. If you're going to take that call, that's on your decision. Private sectors, we have like a set time and set pay. And medical colleges, same thing. You get the set time, set pay. You'll teach patients and students. So yeah, that depends on what you want. Your work-life balance. Accordingly, you will decide whether you want to go into freelancing or private practice or the medical line. Yeah.
Yeah. So basically, it boils down to know what you would like to have in either, like, as you know, benefit versus the risks, right? But on an average, what would be the numbers which?
Average, you will earn maybe about 1 to 3 lakhs maybe in a
Mhm,
month.
mhm.
Probably means, I guess that's the pay in the private sectors. It
Okay. Mhm,
again, in the private sectors, it depends on the hierarchy. Like you will have junior consultants, then you'll
mhm.
have senior consultants, then you'll have consultants and HODs. So the pay scale is pretty good. It's good.
Got it. Got it. Right. So you also and looked into when it comes to pay, also the work-life balance. So when it comes to anesthesia as a career, what's your opinion? How has been your work-life balance, and how are you able to manage the work and life?
So I have been in anesthesia now for 3 years. 3 years of
Hmm.
my MD and now three
Hmm.
years post MD.
Hmm.
So the MD time, as any department, it's going to be super busy. There is
Yeah.
no saying when your next meal is. There is no saying when you get to sleep the next time. So
Hmm.
that was what anesthesia residency was for me.
Hmm.
Coming to the other side, the happier part of it, it's good. I mean, I have worked in a private college, private sector. So my work was fixed. I knew that I had to work like 9 to 5. I knew that I would be free at 5 o'clock, maximum 6 o'clock. I could
Hmm.
decide my life after that. If I had any other priorities, I could always plan it then. So that was good. It's been good. Yeah. And the money
Got
is
it.
also good. We'll get there.
Yeah. Yeah. Right. So, with all these things said and done, how do you see anesthesia as a specialty to grow in the next 5 to 10 years to come?
5 to 10 years. Anesthesia has already grown in the last 10 years.
Hmm.
So getting into anesthesia now is also like you're getting into it late. So that is what the scope of anesthesia has now become. It has become so vast. I mean,
Hmm.
I think in the next few years we are going to like have to have like MD, DM exams for all of these. They already are, probably not too many seats, but more people are going to opt to do DM instead of fellowships. So that's pretty
Okay.
good. Yeah.
Mhm.
Yeah.
So you mean tell, as now there are many fellowships in each of those core domains, we may have more specialization, more in-depth specialization, getting DM in those places, right? Got it. Right. So this gives us a complete idea of anesthesia as a subject. Now, what we want to know is something more about how you have been and a sneak peek into your life as an anesthesiologist. How you was your PG days after MBBS, and how have you been coping up with anesthesia during your practice, and now taking up the specialization, and also with your passion, whatever passion you have in your life, and how I've been managing that.
So as I told you, my residency days were very hectic
Mhm.
because we were dealing with the labor patients, we were dealing with orthopedic surgeons who would bring crying children into the wards at at 1 o'clock in the night, and you cannot say no to these emergency surgeries. You have to put aside all your difficulties and everything that you are going through to be able to help your colleagues as well as the patients. So that was, yes, a difficult time, but I think that was fun as well. It was always like busy. You knew that something was going to happen next. So that was also good. And yeah, I've been quite happy with anesthesia. Now that I think of it, I don't know what I would have done if it wasn't anesthesia. I don't know if I would have fit in anywhere else if it wasn't anesthesia. So that is what has happened to me now. Anesthesia is like under my skin. It is now totally a part of me. Yeah. And
Got
in this
it.
COVID pandemic, it's very difficult. I mean, there are few departments that have been like solely, not solely, but majorly involved, especially the anesthesiologist, emergency medicine, medicine pulmonologists. We are like really trying really hard, and I appreciate everyone who's worked with it. It's actually, put a strain, but yeah, I think it's worth the trouble maybe to save those patients. It's really good. I think it's good. Yeah.
Got it. Right. So that's nice to know what how you have been creating and how it has taken the toll on you, and you're liking the busy schedule when you're the working in that area. What has been the challenging part of taking anesthesia as a specialty? One of the challenging aspects. What do you share?
As- So the point with anesthesia is that because we're dealing with all the other departments,
Mm-hmm.
as and when there is any advance in their side, there has to be an advance in our side. So that
Mm-hmm.
is a good challenge. We have to keep updating ourselves so that we can do best for the patient. The outcome ultimately has to be the patient has to be safe and has to
Mm-hmm.
have the surgery or the procedure done safely, what is best for him. So
Mm-hmm.
if they are opting for a different method, then we have to change our methods as well for them. So each patient is very different. You may say that, okay, there are 10 patients that are taken up for surgery, but every patient has a different problem. Every patient is faced differently. So it's like a mathematical challenge, like you are given this and you try to solve it. It's a lot of mental work and a lot of running on your feet to do all that. So that for me is actually a challenge, and I like it. Every day is different. That is what I like about anesthesia. It's not the same old, going and same old thing over and over. Every day you have something to look forward to every day. That's good.
Got it. So, of course, there are a lot of new advancements which happens in diseases and the treatments. Inside wise, you also have to get updated with anesthesia or what goes along with that type of
Yes.
diseases, right? Got it. Yeah. So, of course, there are challenges. So, amongst the challenges, what has been the best part of taking anesthesia as a specialty for
The best part of taking anesthesia is that as I told you, I was always inclined to doing the diagnosis part. So
you? Uh-huh.
anesthesia gives you like the best of both worlds. You get a lot of diagnosis opportunities to find out what the problem is and try to treat that on table as well as in the ICUs. It's really dynamic, as well as there are a lot of procedures that are done in anesthesia as well. It's not that we are just doing theoretic work or clerical work here. We have a lot of work that we are doing, small, major, central lines, peripheral lines, whatever it is.
Mm-hmm.
So regional anesthesia, there are a lot of new things coming up in anesthesia. So that's really good. It's like you get a good taste of both the medicine as well as the surgical side of it. It's a mix of both. So that's good. That's what I enjoy. Yeah.
Great. So I think we are almost at the end. What would be your guidance to the young doctors who are who wanting to take anesthesia as a specialty or not sure on should I take anesthesia as a specialty? What's your guidance on to that?
As it is with all our medical subjects, you don't need to be super smart to be a good doctor. You need to be able to continuously and want to have to work that hard. So if there is someone who's willing to put in those hours and there is someone who is willing to reap the benefits of it, I would say, then they should definitely take anesthesia. It's actually a very satisfying job. It's good when the patient tells you that, yes, I'm feeling good, thank you for helping me. that really helps. Yes.
Wow, that's amazing. So, Dr. Deepasri, no, I could see that you have taken a super specialty into onco anesthesia, and you mentioned it's a calling which you had, so that you can know. Oncology is an area which is because of the again the oldening generation of India. We have a lot of old population. The cancer is increasing. I could see a lot of passion in you and commitment to to be with those type of those cancerous patients and give them a
Yes.
relief and also help them in their sufferings. Really, it inspires us to see you, taking anesthesia and growing in heights. Really, Dr. Deepasri, thank you so much for being here today and inspiring our students. I think most of our
Thank you.
students get an insight of what you have shared, and also they could see forward to what they can make a decision on based on what you have shared. Thank you, Dr. Deepasri.
Thank you, Sajjan.
Isn't this valuable to know the career pathway of a specialist? Hear from experiences of 50 plus consultant doctors from across India. Get an insight into 22 plus medical specialties and make an informed career decision which will shape your future. Join India's first of a kind online medical specialty summit exclusively designed for medical students. Visit our website drsajjanacademy.com to know more. Don't miss out on this golden opportunity.